follow traffic, clear visual approach, runway 4 right, maintain 17, John Austin, 5 mile final. 17 till 5 out.
Meaningful action by the FAA to help pilots facing mental wellness concerns. From the National Business Aviation Association, this is Flight Plan. I'm your host, Rob Finfrock. The Federal Aviation Administration recently updated its guidance to aviation medical examiners for evaluating mental wellness of pilots, giving AMEs greater autonomy in their evaluations. With more, here's Dr. Clayton Cole, Chief of the Section of Transportation Medicine at Mayo Clinic and also a senior AME.
The FAA has undergone a lot of work to try to streamline the process of how we as aviation medical examiners adjudicate these mental health conditions that are definitely not uncommon to pilots. And so for a little over a decade, we've been able to approve pilots on a special type of antidepressants that we refer to as the selective serotonin reuptake inhibitors, otherwise known as SSRIs. However, the process of approval for this has been somewhat onerous in that, number one, pilots must go through what's referred to as a HIMSS-trained aviation medical examiner, HIMSS standing for Human Intervention Motivation Study, which actually stemmed from a study done in the 1970s for pilots that were being considered for special waivers that had drug and alcohol related issues. But for the vast majority of pilots that have mental health conditions such as anxiety or depression, use of SSRIs, obviously that did not involve substance abuse. However, the FAA wanted to work with AMEs to have them adjudicate cases, and therefore specialized training was required to do that. And so aviation medical examiners that go through the HIMSS training course were the ones that would be responsible for seeing pilots and moving that forward. Recently, the FAA has spent a lot of time trying to figure out how to streamline or fast track certain mental health conditions. There are things like generalized anxiety disorder or situational anxiety in particular, where a pilot may have had use of an SSRI for a period of time and then it was discontinued and they're otherwise doing fine at this point. Or, for example, depression, especially things like situational depression, where maybe they were going through a divorce or bereavement of a loss of a family member, or say a child or a parent or something like that, where they were placed on an anxiolytic or maybe on an antidepressant medication, but later it was discontinued. However, when those individuals were being transparent and reporting that as part of their medical application, the AMEs were forced to defer those to the FAA. So the queues for review of those cases were stacking up. So what the FAA has tried to do for some of these things is take the group of cases that are relatively uncomplicated. In other words, pilots that may have been off of medications for a couple of years and have been stable as deemed by their mental health professionals, or something like anxiety disorder for which they're just seeing a therapist regularly, and taking that out of the queue and allowing the aviation medical examiner to simply issue on the spot. For many of our pilots that we see, this will expedite the process significantly and allow the aviation medical examiner to get them a ticket going out the door rather than waiting weeks or perhaps even months, or in sometimes more than a year, for those applications to be adjudicated.
In addition to granting AMEs some added leeway when addressing mental wellness, the FAA also added 3 new medications to its prior list of SSRIs subject to conditional approval. Both actions followed a list of recommendations submitted earlier this year by the Mental Health and Aviation Medical Clearances Aviation Rulemaking Committee, or ARC. NBAA Director of Safety and Flight Operations, Mark Larson, CAM, was part of that committee.
The FAA chartered the ARC in December 2023 to identify, the barriers that keep pilots and air traffic controllers from seeking mental health care, and then to make recommendations that would, break down those barriers. The ARC ultimately made 24 recommendations to address the barriers, and I won't cover all of them in full detail, but let me see if I can give some insight into sort of some themes here that came up. Big picture, some themes here. We really want to encourage early intervention in situations where there are mental health concerns. So we did have a recommendation that would remove the requirement to disclose things like talk therapy, so folks can get in and get to a professional mental health provider without the concern that that's going to be a consideration when it comes time to renew an FAA medical certificate. Also, as well, too, the airline side of the industry has relied heavily on peer support programs to this point, which don't have the disclosure requirements of the FAA. I certainly see some benefit in terms of addressing some of the cultural aspects and saying, it's okay to not be okay, and here's where resources can exist to go get that help, and certainly ensuring that folks have access to what they need when they need it as well. So tried to just really address a broad spectrum of issues as we saw it, and really hoping that with these changes fully implemented, we're going to see individuals much more comfortable with getting mental health care when they need it within the industry.
My third guest today is Matthew McNeil, President, Clinical Director, and Director of Human Performance at Lift Effect. Matt, can you provide some context on how prevalent mental wellness issues are among pilots?
If you look at mental health just in the general population, the latest CDC stats from, I believe it was 2023, about 1 in 8 adults experience regular feelings of anxiety and worry, about 1 in 20 feeling depressed, and 6 million emergency department visits annually for mental health, behavioral types of issues. And about 50,000 people lose their lives to suicide, which is about 15 suicide deaths per 100,000. Now, professional pilots, they may have unique personality traits and coping mechanisms. There's no reason to believe that they are any different from the general population in terms of susceptibility to mental health issues. And in fact, pilots are likely at higher risk of underdiagnosis and undertreatment of mental health problems due to their well-documented healthcare avoidance behaviors, which stem from professional stigma, fear of losing their medical certification, those types of things. Our clinic, we treat approximately 150 to 200 professional pilots monthly, and we've observed that business pilots are particularly underserved. In terms of our patient population, they make up less than 5%. And so we believe that this underrepresentation, while there's a lot of varying factors to this, I think it's primarily a lack of initial services for mental health issues and just inadequate disability insurance coverages for these types of pilots.
Are more pilots now seeking help, Matt?
We're getting more and more pilots that are reaching out per month. Is that attributed to the ARC? I don't think so. I don't think most pilots even know about some of these changes. We're starting to see, on some of the threads and the text threads that it's starting to trickle through. But I think generationally, as a lot of younger pilots are being hired at the carriers and they've got the peer support programs, which makes a lot of referrals, I think the younger generation of pilots are much more apt to reach out for help. It's really hard to say whether the changes have really led to any increased utilization. I'm not sure I could speak to that. But in general, I think the stigma of mental health with the younger generation of pilots that are coming in, they're just more likely to reach out for help. They're not as interested in hiding as I think the older generations have been.
Interesting observations there. Mark, how does this situation look to you moving forward?
The FAA has taken some initial steps, and I'm certainly hopeful that we're going to continue to see more things roll out that continue to reduce, for example, the timelines that we're seeing for approval to start being on an acceptable antidepressant medication, or to, again, further make sure that folks have access to therapy, to the professional resources that they may need in these cases. So it's an area that we're working on at NBAA as well, too, to make sure that business aviation has access to these resources in a timely manner. And so we're continuing to make efforts in that area to bring some of the comparable resources that, let's say, the airlines have to business aviation as well. So stay tuned for more on that in the coming months. As further efforts come out from the FAA, we'll certainly continue to make the industry aware of them, and the hopes that the business aviation community is able to take advantage of those opportunities as well, too.
Clay, as an AME, what are your expectations of how these recommendations and the updated FAA guidance will help pilots facing mental wellness concerns?
Well, I agree with the assertion that more pilots will tend to report, knowing that there maybe is an environment that will help fast track certain things. I think there always has been among the pilot community a sense for, what the FAA doesn't know won't hurt them kind of concept. And I think part of it is, from an AME perspective, is building trust with the pilots who come and see you. And I think it's incredibly important to be fully transparent with the process, to break down the moment as much as possible and to let the pilot know that there is a process in place and where it fits within their particular paradigm. I think that the FAA, of course, always has to deal with mental health in a way that protects public safety. I think we've seen some sobering cases. When you're dealing with mental health, there's a lot of qualitative as opposed to quantitative measures that have to be taken into account. And so I think the FAA has to tiptoe lightly through this process because there is a lot of moving parts. It's not just the pilot coming into the office, it's the AME and appropriately and competently adjudicating these cases and getting the supporting paperwork forensically to the agency so that they can figure out, can we allow the AME to recertify every year if, for example, the pilot's on the same dose and seeing their regular mental health professional, et cetera. So I am very encouraged by the changes that are going on. I do think it is going to cause some AMEs to have pause and feel uncomfortable, but I think we're all going through this level of not being comfortable.
Given that both sides are learning to navigate these new processes, Clay, what advice would you give to pilots in this new environment?
Well, the first thing I would tell pilots from any form of aviation is, if you see something, in other words, in yourself or your family, try to be a good listener, and people sometimes will give you feedback. Or if it's someone with whom you work, if you see something, say something, as they say, to bring it out and to get help. You need to get treatment just like you do for coronary artery disease, high blood pressure, or diabetes. It is a medical condition, and you need to get appropriate help for it. And to know that there are professionals out there who really do amazing work, and to engage with those individuals. On the aeromedical certification side, the people that are doing the work as a HIMSS AME, they know what they're doing. They wouldn't be a HIMSS AME if they didn't want to advocate for pilots and to help. And so I would say that for a pilot that's out there thinking about, gee, should I actually report this? The answer is, first get help. And then, yes, you should, because the environment now is such that reporting is the way to go. Once you get through that first wicket of reporting, the follow-up after that, as long as things are stable and not recurrent, is kind of a nothing burger. And I have dozens of pilots in business aviation and elsewhere in the majors and all kind, agricultural spray pilots, et cetera, that get to go out and do their thing because they've done it right up front, got the appropriate certification, and then the reporting process after that is really simple.
I second what Dr. Cole had to say. Is we encourage every pilot to report. We don't see the FAA as really the obstacle. The timeline needs improvement, and that's the hard part. And especially if you're underinsured, that can be a problem. But we don't see the problems with the FAA. There's a process. You have to understand how to do the process. There's an order to which to do the process. And when you don't follow that, that can sort of delay things. But we find that actually the biggest hurdle really is the savviness of the AME, because not all AMEs are the same. And we really encourage our clients to work with a HIMSS AME, because if you just go to maybe an AME that's not HIMSS trained or that doesn't really see a lot of pilots, we find that maybe they're not completely up to date on what the FAA's expectations are, and they will, defer, or it's just, there's a lot more mistakes there. So It's really the savviness of the AME, I think, is the big factor in making sure that you complete the paperwork and get your medical records and your pharmacy records. Those need to be thorough, or that hangs up the process.
Right. And I would also follow up and say, that in terms of what the pilot can do, what they do have in their control, things like writing a personal statement, that is your opportunity to tell your side of the story, so to speak. So I've seen pilots come in and they're trying to run their checklist and doing it as quickly as possible. And they write, the equivalent of see above, see below, any questions, let me know, and they sign and date it. It's like, well, that's not real helpful to your case. You need to think through have that introspective moment and take a little time to go through the history and to let that reviewer at the FAA know why you should be approved at this point. And so there are little things like that the AME can help, I'll say, coach that pilot to actually spend some time. Not obviously, they're not writing the personal statement for them, but to provide them some clues as to the process.
You've mentioned some great points, Matt and Clay. Thank you. Mark, what are your thoughts?
These things exist on a spectrum, right? It can be we're having a little issue, something of concern, to the point of we're at a spot where it's time for some professional intervention, to full on truly we've got a mental illness, and so I would say to the greatest extent that we can go work and tackles and the issue, whatever that is, early on, that's going to be the easier resolution for you, and most likely the easier resolution from a medical certification standpoint as well. So I hear this consistently from the FAA and many others. Now, look, if it's a later, more advanced situation that's happened, you've got to be your advocate for that and have a great team, the right AME, for example, and really put all the right information into the system so the FAA can review it and get the answer back you're hopefully looking for. So they're trying to get to yes, certainly, where they can safely. So that's big picture piece. And again, we're actively working to try and bring more of these resources to business aviation. That's going to help in that process and help business aviation pilots in moving forward on these issues, that much sooner, that much easier as well.
Mental wellness and other aeromedical concerns are a top priority for NBAA as an association, and in particular for the NBAA Safety Committee. This is an ongoing conversation, one that will also be continued during the Single Pilot Safety Stand Down and the National Safety Forum, both taking place during NBAA's Business Aviation Convention and Exhibition coming up in October in Las Vegas. Learn more about that at nbaa.org/BACE. And also be sure to check out NBAA's Medical Issues resource at nbaa.org/medical for information about mental wellness and a variety of other medical conditions and concerns. And that's the latest from the National Business Aviation Association. Remember, you can subscribe to all Flight Plan episodes wherever you find your favorite podcasts or by asking your virtual assistant or connected device. You can also download episodes directly from nbaa.org. I'm Rob Finfrock. Thanks for listening, and join us next time for a new episode of Flight Plan.
Right base, sending out 3500.
All right, we got him inside. We're slowing it back to 170.